Hey guys, Doc Heps here. So passing stones is worse than childbirth for a lot of folks, and those folks who continue to make them feel like a rock quarry. So we're going to go over ways to stop making these stones, prevention, why they form, and hopefully you'll get some insight as to how best move forward so you can stop these stones from coming back. Hey guys, Doc Heps here. So the question is, you're passing these stones, the pain is so intense, it's like worse than childbirth. You feel like a rock quarry. How can you stop making these stones? So we're going to go over some of the reasons why people form stones, some of the strategies for prevention, the evaluation as to how we approach people who form stones and what kind of testing might be beneficial. Let's go into a little bit more of why stones form. And it's kind of a little bit of just traditional chemistry, basic chemistry, but there are also other factors that go into it. A significant proportion of people will have a family history, so there's definitely a genetic component. We haven't identified the gene that passes that along, but we know from history that if you're a stone former, it's not unusual that someone in your family is too. Diabetics tend to have a higher risk of stone formation. Again, we don't know exactly why, but we do know that folks with diabetes do have a higher risk. And controlling that, controlling your glucose, controlling your sugar does help reduce that risk of stone formation. Abnormal anatomy. So if there's a kink, a curve, in any of the urologic systems, sometimes people have a kink at the level of where the kidney drains into the ureter tube. Sometimes folks have some sort of genetic and congenital, meaning they're born with it, blockage in the ureter. Any place where there's some sort of holdup or backup of urine, all those electrolytes, all those crystals can tend to form and cause stone. Other things that you might have more control over is your urine volume. Basically, how much fluid you intake and the types of foods you eat can contribute to your risk of stone formation. The more fluid you drink, the more likely those crystals that eventually produce stones will dissolve in that urine. So hydration is key. So it's really what we call multifactorial. You may have one prominent reason where you're just not taking in enough fluids, and then you have a genetic history, and boom, you're a stone former. But those are the main reasons why folks tend to form stones. So how do we figure this out? Well, the genetic component, you just take a history. You know if your mom or dad had stones. That's easy. Whether you're a diabetic, whether you're overweight or obese, those are things that you as a person can potentially control. Oftentimes, we'll get some sort of imaging to better understand and better assess whether there's any anatomic kink or blockage. Sometimes that might be as simple as an ultrasound. Sometimes it's a more sophisticated test like a CT scan that can help better characterize for us as urologists to understand what the anatomy is. And if we treat this stone but don't treat the anatomic problem, those stones may just come right back. And then there's a whole component called the metabolic workup. And the metabolic workup basically has three main components. It's a blood work test, there's urine-based testing, and there's analysis of any stones that you may have captured or caught, whether you passed them or whether your doc sort of grabbed one during any procedures that you might have had. So the metabolic workup, blood work component, it includes a few different things. One is called a basic metabolic panel, which is a routine set of labs that is easy to get. And sometimes we can use these electrolyte levels to see if there's some genetic problem with your kidney that might predispose you to stone formation. On top of that, we'll get a uric acid blood work test and also a parathyroid and calcium blood work test. The uric acid test measures the amount of urate in your blood, and that, if elevated, can predispose you to uric acid stones. Uric acid crystals can form in the bloodstream and float down into joints, and that can cause gout. But folks may not have traditional gout, but they may form uric acid stones in the kidney, and that cause a lot of trouble and fall into the ureter and cause pain, so forth and so on. So if we can measure your uric acid and identify that problem, there are definitely some good solutions and treatments for that. Parathyroid hormone is a hormone that helps regulate the calcium levels in your body. So rarely, but importantly, some folks may have a small growth on one of their parathyroid glands. The parathyroid glands lie on the neck on top of the thyroid gland, and there's typically 4 of them. And any of these tiny glands can have a small growth and produce abnormal amounts of parathyroid hormone. If that's the case, you'll be excessively sucking up calcium in your diet and potentially from your bones. That calcium gets into the bloodstream and can elevate your bloodstream calcium. And what your body does and what your kidney does is try to keep that bloodstream calcium very rock steady, very level. So it pushes all the excess calcium into your kidneys, where it gets rid of it and it excretes it in the urine. But that excess calcium in the kidneys can lead to kidney stones. So a parathyroid hormone blood test, if elevated, can prompt a workup to see if you have a little growth on the parathyroid. Although this is fairly unusual, it's potentially a fixable problem, and it can help eliminate stones altogether if recognized. The second component is a urine-based test. Urine-based test is typically what's called a 24-hour urine. So there's different companies. We use a company called Litholink. It's basically a kit is sent to your home often, and there's easy to follow instructions, but basically you have to have a day where you're able to collect your urine for 24 hours. And then you send that urine back to the Litholink company. They assess it for not only how much, but also different parameters and electrolytes that may affect why you're forming these stones. They look at calcium, magnesium, they look at sodium, they look at citrate, oxalate, uric acid. A number of these parameters help guide us as urologists and nephrologists to better understand why you're forming these stones. So a common result might be urine output is fairly minimal and you're at high risk of stone formation. Oftentimes that's the only abnormality we find. All the electrolytes are normal, but you're just not drinking enough fluid to help prevent this. And that sort of quantifies something that is easy to fix. Other things, such as if your calcium level is excessive or your oxalate level is excessive, we can give you some dietary guidelines and recommendations, and maybe even some medicines if needed to help improve those parameters so that your risk of stone formation is lower. Lastly, the stone analysis. The stone analysis is a test that basically tells us the type of stone that you're making. Probably 95 to 98% of folks form calcium oxalate stones. And another significant percent, and it may change, it's higher in diabetics, form uric acid stones. And some people form a combination of these. There are different stone types that are less common. These include cystine and calcium phosphate stones. Understanding and knowing what your type of stone can help be a piece of the puzzle to help in prevention of these annoying stones. So a little bit about how we treat folks. In terms of diet, sort of, again, the fundamentals are make about 2 liters of urine. So most times we recommend at least 1.5 liters of fluid intake. Types of fluids, the citrus, so lemonade, lemon water, lemon juice is thought to have the highest concentration of citrus or citrate. And so citrate is a stone preventer. So circling back to a little bit of the chemistry, what happens in our urine is that all these electrolytes are all initially floating around in the urine. You have calcium, you have oxalate, you have citrate. And so all these electrolytes are bouncing against and binding each other. And some of these electrolytes can bind and they form crystals. Other electrolytes are much less likely to form crystals. So in folks who are calcium oxalate stone formers, if you increase the citrate, that citrate is more likely to bind up to that calcium molecule, and that doesn't form a crystal in general. Whereas if you have tons of oxalate and tons of calcium and very low citrate, that calcium oxalate molecule is going to bind, and that tends to form crystals. So the concept is dilute the urine with lots of volume and increase the citrate. So the calcium citrate is more prominent than the calcium oxalate, and thereby you'll form less calcium oxalate stones. So the way to do that in the diet is drink fluids, squeeze a bit of lemon into your water, and that's going to be likely the best way from a dietary standpoint to prevent some stones, or at least a first step. Oxalate. Oxalate's in a lot of healthy items. So oxalate's in leafy greens, spinach, nuts, chocolates. So what I tend to recommend is if you have a leafy green or a high oxalate food, and there's lists, you can see them on the internet, it's easy to access, but oftentimes I'll recommend having some cheese or calcium heavy food along with that high oxalate containing foods. So for example, if you have a spinach salad, throw some cheese on there, because the theory is that that calcium in the cheese will bind up the oxalate in the spinach. And that binding doesn't occur in the bloodstream. That binding occurs in your stomach, in your gut, and you just poop it out, so that you absorb less individual calcium and oxalate. That binding happens in the gut, and it won't hopefully be transmitted into your blood and then into your urine. So again, it's a balance, because again, those oxalates, those high oxalate foods are pretty healthy. So finding a sweet spot and looking at your 24-hour urine before and after you adjust diet will help guide us. Monitoring your sodium levels. So in folks who have a lot of calcium in their urine, oftentimes sodium can be the problem. So what happens when you eat a lot of salt, the kidneys try and balance out the electrolytes in your system. So by simply adjusting your salt intake downwards, you can downward trend the calcium in your urine. And that will also help prevent stone formation. Medications, treatment. So if you have a persistently low citrate, despite supplementing with lemon water and lemon juice, there is medicine that comes in different forms. It's the most common one is called potassium citrate. Potassium citrate is a big old horse pill that typically you take a couple of times a day, and it very effectively will increase the citrate in your urine. The main problem with it is a lot of folks have some GI side effects. So some people will have a tendency to try it and then they just give it up because it just doesn't make them feel good. But it is very effective in increasing the citrate in your urine and thereby preventing future stone formation. Other medicine include blood pressure medicines like hydrochlorothiazide or chlorthalidone. These are used in folks who spill excessive amounts of calcium in their urine. So what these medicines do effectively is it helps prevent the ability of calcium dumping into your urine, and reduces the amount of calcium in your urine, thereby reducing the amount of stones that you would form. And these can, again, be effective in some folks. Usually they're used in a low dose. Hydrochlorothiazide is usually given twice a day, chlorothalidone once a day, so that's just a matter of convenience. But they're most effective in folks who have excessive calcium levels in the urine. So in folks who have high blood levels of uric acid, there's a medicine called allopurinol. And allopurinol helps prevent uric acid crystal formation. And that can be very effective in reducing uric acid crystals, and in some folks can eliminate uric acid stones altogether. The when and why we use it is really informed by that 24-hour urine, and if diet doesn't work, then these medications are sometimes the next step. I also mentioned the parathyroid hormone. So if your parathyroid hormone is elevated in your blood, oftentimes we'll work in collaboration with someone called an endocrinologist who's a hormone doctor. They'll get some sort of imaging to better understand why your parathyroid hormone is elevated. If this imaging and evaluation indicate that one of those parathyroid glands have a small lump, or called an adenoma, that's excessively producing parathyroid hormone, they can send you to an endocrine surgeon. And if they agree and feel like your parathyroid hormone, that little adenoma, should be removed, oftentimes that will normalize your parathyroid hormone levels and you'll stop forming stones. So that's why I think it's an important blood test to measure. Although it's not a common finding, if identified, it can be very effective treatment. So just to circle back on dietary fundamentals, make 2 liters of urine, drink 1.5 liters of fluids, lemonade, lemon water, lemon juice, increases the citrate and is healthy and good at preventing stones. Have a moderate calcium intake, not too high, not too low. That's the sweet spot for stone prevention. A low salt diet. Stay with a low salt diet. Watch salt in like canned products, canned foods, processed foods, canned soups are a big culprit for high salt intake. You want to stick with a relatively low animal protein diet and manage your oxalate levels. Oxalate is part of the calcium oxalate stone that occur in 90% of folks. You should get a metabolic workup. I don't think everybody needs to. If you've had 1 stone in your life and you're 60 years old, you probably don't need to. Just follow the dietary tricks and recommendations and you'll likely be fine. But if you're young, you've formed a couple of stones already, you have a strong family history, I would definitely get a metabolic assessment, some blood work, and if possible, a stone analysis, and go over these things that we talked about to hopefully optimize your chance for getting rid of these stones and preventing them. Thanks for watching. Check out our other videos. Be sure to subscribe, and I appreciate your time. Thanks.